Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Welcome to another episode of the Medical Collective podcast. This is a solo episode with your host, yours truly, Dr. Keisha Davis. And I wanted to talk about why I believe many of my colleagues still believe in science. It's a time when headlines change by the hour. Everyone online seems to have an opinion about health, and I find myself back to one simple truth. I still believe in science. Over the years, I have seen medicine change. I started in medicine during a time when we carried books around, when we did test tubes in the laboratory, and things have changed. Not just the tools and technology, but the public's trust in what we do. Somewhere along the way, science became political and the value of the physician's voice started to fade. But science hasn't changed. Its purpose to seek truth, to save lives, and to correct itself when it's wrong is still there. So today, I want to speak with you about why I still believe in science as a doctor, as a mother, and as someone who has watched the profession evolve into a front of a global audience. I want to start with the personal side. I grew up knowing I wanted to be a doctor. Well, actually, I knew growing up that I was going to be a doctor, a dancer, a singer, and I couldn't even sing, and a flutist. That is that I was going to do it all. My father had his opinion otherwise to go into medicine as he's a retired physician. And my mother really was allowing all of my passions to evolve. I went to jazz twice a week. We played the flute, the piano, what have you. I was very well versed in different things, and I think that's important. But one thing that I remember is that when I wanted to go into medicine, it was a very well-respected field. When I looked at my father, and it wasn't the money attached with it, it was the esteem of being someone in charge of somebody's health. You are making a determination on someone's well-being, if they have disease, if they have cancer, what have you. And you really have sacrificed your life and your time, even with your family, as my father did a lot, to be able to do this and practice this full time. So I think, to me personally, that is where the physician and the ideology of this physician as this great being that had the hands to be able to heal from. And science in general. In the laboratory, I remember many of the discoveries we had. I held to high esteem those who were scientists, those who were making discoveries. I thought they were amazing. Many other people may have been idolizing Michael Jordan at the time or Michael Jackson, both amazing in their own right. But I was idolizing or looking up to those that were actually in the science fields. I think when I was going back to training, the method of looking at things, questioning, and I questioned a lot. Let me tell you, I questioned to the point where my dad was like, look it up in the encyclopedia. We didn't have ChatGPT. We had the encyclopedia. So I would look things up in the encyclopedia when I would ask a question. But I also learned about how to hypothesize, to make an assumption, and to test that hypothesis to make an informed decision or assumption based on all of that guidance, not to just guess. I never ever was a person that was just guessing, well, I feel this way. We're feeling about science now, and before we thought about it and we knew based on observation and testing. It's not about this blind belief. It's about evidence that can be verified and challenged. When I was doing work in college, I loved the laboratory. I loved testing hypotheses. I thought it was amazing. And then when I got into medical school, very much the same. Finding out the history of medicine, I took a course on the history of medicine. I would always be questioning, and that's probably why I gravitated towards pathology, is because it's science-based and it's really everything upon which every other field relies upon, understanding the study of disease. And I learned early on, and I think this is where people are getting confused, nothing is black or white. There are very few things. There are things that I remember I could say, oh, this is cancer. But I remember my attendings always being like compatible with, and my colleagues and other doctors will laugh, clinical correlation recommended, right? Because the art of medicine tells you that it really depends on the person, the situation, and the facts that you have to make an informed decision. Not everything fits. And even the test wants you to believe there's a right or wrong answer. And we knew that. But we knew when we practiced medicine, that's where the real test comes into play, is when you take all of that knowledge and put it into a real life scenario. All of this guided me as a pathologist when I started to practice. There were biopsy results when I learned early on. This is the funny thing. When you first get out in practice, you don't know that your first case is trying, no matter how simple it is. Everything that you learned, the years and years, it like goes out the door for a minute, and you're just humbled by that time where what I put on this paper and I press release the case is going to forever be in that patient's medical record. And you start to like get scared. At the same time, I realized that means I need to know the context. I need to talk to the clinician, and I need to know that it's okay not to put a definite answer. We do a lot of that. We may do suggestive of. I remember seeing inflammation, and the physician just knew it was tumor, but we kept getting a lot of inflammatory stuff and nothing outright. And you want it to be for that person because you're like, there's a mass, there has to be. But if you don't see it, that's where the ambiguity goes, is I don't see it, so I really can't call it yet. And I can't give it a definitive sometimes. It's crazy. Or those tumors you see in a textbook that now, because of the science, I'm able to see them in a patient and help them be able to know, okay, we see this tumor. Now the doctor is going to go and make the necessary, whether surgery or treatments, to guide that patient, all based on science. These are the behind the scenes undercover heroes. That's what I went into it for, to be one of those undercover heroes. And I think as a pathologist, I knew I wasn't going to get the fame or notoriety of a surgeon or a physician who the family members are seeing every day taking care of their child, but I'm behind the scenes, the scientist behind the scenes doing the work, making discoveries for patient care. Amazing stuff. All of this deepened my belief and trust in science. Even when the answers are difficult or during the pandemic, I never trusted science less. I think that's when people need to sit back and say, is it the science that's questionable or the person delivering it? Or it's so complex that I can't understand it, but that doesn't mean that the information is not valid. I think that's what happened along the way. But I have never, ever stopped trusting science. The people that deliver it, maybe so. The healthcare system, definitely distrust in there. The people now that are trying to monetize off of healthcare or monetize off of a disenfranchised group like Black women and say, you don't need doctors, buy this instead. I distrust that. But that is people taking a trustworthy belief in science and trying to warp it and manipulate it for their benefit only, not the benefit of the patient at all. I also learned early on the difference between science and then the practice of said field of medicine, the practice of pathology. So pathology, great. The practice of pathology can be difficult at times and problematic. Same thing, medicine and the practice of medicine, and having to do with insurance issues and having to deal with even the politics inside of a department. That part, you can leave it, which is why I love locums, because the politics part, I can come in, I can practice medicine and science, and I can leave all the rest behind. All of it behind. The scary, the sad, unfortunate part is when what I saw during the pandemic, and I'll get into it. That's when I started to say, I love science, but where it has been brought to and what it's in is scary. When it starts to jeopardize your well-being, your happiness, even the safety of you and your family, sometimes you might have to let that science go, unfortunately. So between the microscope, which I love, and between the media, unfortunately, science has taken a backseat. It's taken a backseat to influencers, has taken a backseat to politicians, and the patients and the clinicians and the scientists are left. So I want to talk about why that is. To me, it's the erosion of trust. The erosion of trust. Science, and why I still love and trust science, has been eroded by trust, right? So the package is still the same, or what's inside the content is still the same, but the outer package, kind of like sometimes what happens when you get your package from Amazon, it's broken and whatever, but inside everything you need is still there and working and functioning. Pew Research said, and this is from last year, Pew Research said only 57% of Americans say they have a great deal of confidence in scientists. That is down 87% in 2019. So from 87% having confidence in scientists went down from 57. And these are scientists. I'm not talking about the people over corporations, the CEOs, right? Or what happened with Theranos. I'm not talking about those things. I'm talking about the trust in scientists doing the work, the bench work. I think we also are confusing who the scientists are. An AMA report said that nearly 1 in 3 physicians say that misinformation has directly affected their patient care decisions. Misinformation. I hear it all the time from my friends, my colleagues, that patients come in and have tried this or refuse in the middle of an emergency when they're in labor because of what they've been told. That's misinformation. And to be honest, disinformation. And WHO has said that misinformation during the pandemic was labeled as an infodemic. 100%. We had a pandemic with the virus, but we had an infodemic. We most certainly did. Spreading faster than the virus itself, and it did. And I'll tell you some more about that. In a KFF survey, over 40% of Americans have encountered false claims about vaccines or public health just in the past month. Over 40%. And I would say that's probably close to 50, if not more, have encountered false claims, because now we have to deal with virality. And I didn't have that. Remember, I told you my father would say, go look in the encyclopedia. So we had solid books, resources to go to for information. And it was like snail mail getting that information out. But now you have the internet, the World Wide Web, and stuff goes viral fast. And the stuff that is clickbait, that is an influencer that knows how to speak to the camera to get you to listen to them, not the doctors, to go onto your empathy or the bad experience you had and take that and lead with misinformation. That truly is the problem. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. Somewhere along the way, evidence has become optional, and experts can say the enemy. People have stopped seeing physicians as partners in their health. I see that and I hear that. And they started viewing us as part of a system to distrust. And I'm going to tell you that happened during the pandemic, even as a pathologist. Even as a pathologist during the pandemic, I would go into social media rooms and lives on different apps, and I would hear people say, how do we really know that there's even a virus? How do we even know that there is a virus? And it hurt me because I think about the pain that I went through, the many years. And at first, I was not good looking in the microscope. That was a whole nother thing. But the years I spent looking in a microscope, trying to make sure I was making the right diagnosis for a patient, and they were saying that the virus was not real, and that people were making up the results, so that the diagnosis that was happening in the laboratory with people that would spend hours upon day away from their family, caring for you, and you don't even know who they are, that they are lying about those test results. And we're making all that up in the laboratory, and we're falsifying death certificates. All of that was being said. And it's not one side. That's what I'm like, the zone or the shades of medicine and science are based on sometimes a finding can mean different things. But the shades of gray should not be because the test is positive or not. Or maybe there's not even a test. Or maybe there's not even a virus. Or there's no even thing as pathology. None of that exists. That's when we start to get into a whole nother thing that reminds me of the Matrix and starts to be paranoia and starts to be delusions when we really start to question everything. And there shouldn't be a side to that. The truth is that science is not partisan. It doesn't take sides. It's not red. It's not blue. It's data, discovery, and dialogue. Which brings me to the next part. Separating politics from evidence. It has been hard. And we have had scientists that have been part of Republican and Democratic presidencies. We have had Dr. Fauci, who helped us get through the AIDS epidemic, nonpartisan. And now it has become a political stance. It has become a political stance. During the pandemic, leaders should be leaders, and they should know when to divert. They should know when to take the advice of their experts and allow them to lead in that conversation. Fauci was even afraid at some times to speak up. He said the one time he spoke up, he thought about it. You know, we go through a Hippocratic oath, do no harm. And though you may hear about the doctors that may do harm, there are many more that don't. And he put his life on the line, and he said, what he is saying right now is wrong. Should I speak up and risk persecution, or should I stay silent and do the patient's harm? The millions of people that are listening right now to this address. And so he corrected it. He corrected it, which has happened to me. I've tried correcting things, it becomes a problem. But he corrected it in the name of science, and he was scolded. And that is truly when the attacks on Fauci began. Not when he was taking us out of the AIDS epidemic, when he was doing all his work and research, when he's spoken through many presidencies. It was then and there that it became, how dare you? That to me is how now we are taking science with the facts. It wasn't another scientist saying Dr. Fauci wrong. And I'm talking about not a person calling themselves a doctor. Check out the episode on Not Every Doctor is a Doctor. But it wasn't that. It was someone non-science based that was like, how dare you speak against me no matter if what I say is incorrect. going against him. And that's really when it arose. I have never been more concerned, and I'm glad actually that I saw my love for science and trust for science and how it used to be, and it's evolved. So I know that there's hope because I saw what it was. And then again, the science, not the practice of science and medicine, and how we can get back to just trusting science. But the politicization of it has made it very murky and difficult. Scientific progresses, they do rely on debate and replication, but not a political alignment. It should not be the people on the right don't want vaccines, the people on the left do. Like if we see, and you've listened to Dr. Tusa on how they have gotten us out of many different pandemics, epidemics, where many children have unalived from rubella, from measles. And now we have it coming back because we have now politicized the issue. It has frustrated also as me as I saw what happened on a world stage with someone we look up to as a physician, Dr. Fauci, and him being dismissed. And when people that don't truly understand science are being idolized and put on a pedestal with disinformation. And we all know, and it makes us think all the work we went through, all of the research and people that put countless hours to come up with these amazing research articles and discoveries, and we are now saying that it's not valued. And it really, the sad thing is, it's not that they don't even trust the individual. Truly, they don't. But now they're saying because they don't trust the individual, they're going to go all the way back until the beginning of all of this and say they don't trust science, period. Because that's truly what you have to do. If you're dismissing science, you're dismissing every single person and all of the discoveries that have happened from that. Because we're using the same practices, the same scientific method to come on these conclusions. The same one. Some of the consequences that have happened is when in the middle of the pandemic, people don't get the immunization, drink bleach, don't drink bleach. People got confused because we have really confused, again, experts. We have confused experts with influencers. Our problem is that we have confused experts with influencers. And we therefore think we have a one-stop shop, a 7-Eleven, a Buc-ee's, a Quick Trip, what have you, and think we can get everything from that one person. And it does not work like that. You're not going to get the best of everything. You know, when you go to a one-stop shop, what happens? Quick Trip. You oh no, you forgot your breakfast and you're on a trip. You're not going to find the best breakfast food there. You're not going to find fresh fruits and vegetables there. So you're not going to find high quality. Same thing. You're not going to find high quality science and information and even politics or legal stuff from the person that is leading the country. They are leading and then they are diverting or referring to the specialists to talk about the science, to talk about that. And you've seen it in many presidencies where they'd be like, I'm going to allow this individual to speak on it, not me. And I think that's what's really eroding the trust, but confusing people. So then people are like, okay, well, maybe I shouldn't go to the doctor or I can't get my immunization out. So we have delayed diagnoses because of that. We are now having an increase in preventable illnesses and deaths. Measles. We don't know what's going on with bird flu here, and we know it's rising in the rest of the world. And we're seeing things that we had cleaned up, right, and fixed coming back. So instead of being able to move forward and deal with the inequities in healthcare that we see, with the rising maternal death and infant death, mortality, and gun violence unaliving our children, we can't focus on that and how to get equal healthcare for everybody. We got to go back and fix all of the lies that have been told, the disinformation. We have to go tell people again, Tylenol is okay. That's going to take time away from advancing. We have to go back and start research over for the labs and the individuals that have been let go. All of this cancer research and stuff that people that don't understand science now, again, don't have a love and trust for science. You're not going to spend money on something you don't trust or love. You're just not. And it's sad that science has to be in that bucket that's being discarded. And again, after all of this, after what's happening right now in the media, the politicization of mask mandates, I'm hearing about people that are wearing masks now. Now you have eroded trust in science and the science to where people that are wearing masks are getting attacked and villainized. Reproductive health is being villainized. Doctors that are taking care of their patients are getting villainized. And at the end of the day, all of us are affected by it. If we don't have the science and researchers, we're not going to have the funding and be able to address public health. And public health is everybody's health. We always talk about that. Public health is everybody's health. If all the teachers are sick from COVID or now measles has come back and the children have to quarantine, that's affecting the progress of that community. If more people are getting sick that are bringing your food, that are fixing things, that are in construction, all of that gets delayed. And that affects the bottom line. If we're concerned about the bottom line, it affects that, all because we don't trust science. I will say, and I will do my affirmations, I believe in science because it evolves. Not because it's black or white, because it evolves. It's not afraid to say, we were wrong, and here's what we learned. It's not afraid to say, again, that we're wrong, and here's what we've learned. I also believe in science because every discovery starts with a question, and every answer comes with a responsibility. I believe because I've seen it, and the patients whose life was saved by early detection, and the vaccine that prevented another epidemic, and the collaboration that turned uncertainty into understanding, that's why I believe. Science doesn't need to be perfect. It doesn't need to be absolute to be powerful. It just needs to be pursued with honesty, humility, and heart. And if we want people to believe again, it starts with how we show up. Not just in clinics, but in conversations. And it's why I started the Medical Collective. It truly is. When we saw the frustration and the lack of trust, I wasn't truly thinking, okay, we need to get people to take the vaccine. I said, we need to regain the trust. And we do that by talking about working out, food, access, patient advocacy, public health, emergency medicine, women's health, and coming from people that have been there, done that, and have been through the same issues, difficulties, trying to access care as any other person. So that's actually how it happens. That's actually how we get at these conversations. So everybody listening, being part of this conversation, you're helping bring back the trust in science. And as a physician, I can't afford to sit silently while misinformation spreads louder than the truth. And for all physicians listening, we cannot afford to sit silently while this misinformation spreads louder than the truth. We have to keep speaking, using our voice, sharing each other's communications, and not to win an argument, but to rebuild trust. Again, not to win an argument, but to rebuild trust. If you've ever doubted what science can do, listen to my episode on when I started to get chest pain every day, just from working. It's a reminder of how evidence and empathy come together to save lives. Again, I'm your host, Dr. Keisha Davis, and this is the Medical Collective. Science still matters, everybody. It does. And so do the voices that defend it. And so next time, I will see you. I will listen to your thoughts if you go to medicalcollective.net with a hyphen in the middle and leave an audio message. We love to hear from you. Thank you. Until next time. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.